Thank you very much for joining us and welcome to the 6th day of the California Small Farm Conference. This workshop will be exploring farm worker safety. We have some wonderful panelists. We're going to talk about a study and the results of that and what it's looking like during COVID and beyond. Before we begin, just want to give a big shout out to all of our sponsors who helped make this event possible, not only possible, but free and accessible to everyone. This workshop is being recorded, and that will be placed up on CAF's YouTube channel, and links will be sent out later. My name is Evan Wigg. I'm with Community Alliance with Family Farmers, the host of this year's event. We're an organization for 4 decades has supported and represented family farms across California. You can learn more about us as well as our sponsors of this year's event in the chat. If you have questions throughout the day, we encourage you to use the Q&A in the bottom right hand of your screen. You'll be able to ask questions, and at the end of this workshop, our panelists will get to those. Without much further ado, we welcome our panelists. Thank you so much for being here. It's an incredibly important topic, and it's also the backbone of our agricultural community here in California. So I couldn't think of anything more important to be digging into today. So take it away, and thank you so much for being here.
Thank you, Evan. Really nice to be in front of a small farm conference audience. We've been talking about this as a team, the COVID-19 Farmworker Study and the results in lots of places. And this is our first chance to get in front of a small farm and a food movement audience that I know of. So we welcome this part of the conversation about how our food system is working and how it could work better. So I'm Ildi, Carlisle-Cummins. I am the Executive Director of the California Institute for Rural Studies. And I'm here with 2 colleagues who helped to create and collect data around what was going on in the farm worker community in this time of COVID. I'll pass it to Deysi to introduce herself.
Thank you, Ildi. Good morning, everyone. My name is Deysi Merino, and I work with Farm Worker Care Coalition under Vista Community Clinic, and I thank you all for the opportunity to present here some of our findings today. Thank you, and I'll pass it to Nayamin.
Thank you. Buenos dias. Good morning, everyone. My name is Nayamin Martinez. I am the Executive Director with the Central California Environmental Justice Network, or CCJN, and I'm greeting you from beautiful Fresno.
Thank you. Okay, I'm going to start sharing our screen with our PowerPoint, and then I think, Nayamin, you were going to do a little bit of an opening for us, right? So I'll share screen. And
yes. Thank you. As you could see here in our lovely picture that we have, it's a great background for what we conducted. A farm worker study that surveyed and interviewed farm workers up and down our California state to understand how the COVID pandemic had really impacted them, their families, their workplaces. And we're going to share with you the findings. It's very encouraging for me to say that personally, I was able to conduct several, or if not many, of some of the surveys. And what I noticed is that it was a significant improvement in the working conditions, especially in access to PPE and better working conditions for those farm workers who had the opportunity to work directly with farmers, especially those that are organic farmers. I was able to hear stories where they say, our employers care about us, our employers are concerned about our health, our employers let us take some of the organic fruits and vegetables that we're harvesting because they want us to also have access to these nutritious foods. So I just want to say on behalf of the farm workers who were able to benefit from this, thank you very much. And now we're going to share the findings of our study.
Thank you, Nayamin. Yeah, so as Nayamin mentioned, we're sharing the findings of the COVID-19 Farmworker Study. I'm going to talk about sort of the what we did and who we did it with, and then pass it to my colleagues to talk about some of our key findings and the recommendations for change that really came out of this study. And you can find all of the data and reports. We have 2 reports now and a couple of different sets of policy recommendations up on the website there, COVID-19 Farmworker Study. And I think our friends from CAF are going to link to that in the chat so you can find all of our information online afterwards. And we hope you spread it far and wide. The point of this project was to bring farm worker stories and farm worker voice into the public conversation about how to respond to COVID-19. So we're glad for anyone that helps to pass the word, bring these voices to the forefront, and share the materials that come from here. Okay, so who are we? So I mentioned I work for CIRS, California Institute for Rural Studies. We're in a facilitation role for this study that is really a very broad collective, a collaborative effort with many different partners here. We have 6 community-based partners that are sort of the heart of the study. They're the folks that made this possible in a pandemic time to reach workers because they've done the work over decades of building trust and building networks within farm worker communities. And those partners are listed here. They're the Centro Binacional para el Desarrollo Indígena Oaxaqueño, CBDIO, Comité Cívico del Valle in Imperial County, the Farm Worker Care Coalition, and the Vista Community Clinic. Deysi's here representing them from the San Diego area. CCEJN, Central California Environmental Justice Network, and Nayamin is here representing the Valley, Central Valley, and our partners there, and Alianza Ecologista and Líderes Campesinas. And then there was a big collection of researchers and research associates who helped to conduct our phase 2 study. Their names are listed here, and a whole range of social science researchers and policy advocates. Over 40 people came together really quickly in March as the pandemic was coming down with this key goal. How are we going to make sure that the farm worker story isn't left out of what we're understanding about COVID in our state right now? So we designed in March, when the group came together, we knew we wanted to do this in 2 parts because we knew we needed to act very quickly and do a rapid response survey to understand how COVID was impacting farm workers immediately at work and at home, and in terms of their healthcare access and access to things like testing and treatment. And so we designed a quantitative survey that we conducted from May to July in partnership with our 6 community-based orgs, a phone-based survey. And then in the fall, late summer and fall, we conducted a follow-up interview with 63 farm workers. I didn't mention, but the survey was conducted with 915 workers across the state. And we went back to a smaller subset of them to do longer, in-depth interviews that ask them things about sort of the longer term impacts of the pandemic on their economic well-being, on their families, on their mental health, on levels of stress, those kinds of things, because we knew from the beginning, because we had our community-based partners at the table, we knew from the beginning that this was going to have immediate impacts and impacts that stuck around a lot longer. And CIRS is a research institute, but we have a mission to collect research for action for rural justice in California. And so we also knew from the beginning that we wanted to create tools that would bring this into the policy world, bring this into the media, bring attention to this issue for actual change on the ground. So so that's kind of the shape and the design of the study. I'm going to pass it now to Deysi to talk about some of the things that we learned doing the process I just mentioned.
Thank you so much, Ildi. Yeah, definitely. I was one of the participants that the associates that interview some of these participants in the studies. And a lot of the things that we found is that, so it's not really found. I think these are things that we kind of already know, that our farm community is always, forgotten, and it's underserved, even though they are classified as essential workers. And we did hear from them that when it comes to their workplace, there was uneven enforcement in terms of information about how to protect themselves from COVID, how to keep their distance, just general information, and also especially women. We found that they had to stop working because a lot of them were mothers who had to come back home to take care of the children who were taking virtual classes because the schools were closing down. There was also a lot of stress in the household with only, one parent working and also not having enough economic stability. The kids were struggling in school. A lot of parents didn't have, enough money per se to pay for internet resources, or sometimes they did, but it wasn't a good quality. So a lot of kids were struggling. Teachers were calling parents thinking that the kids were skipping classes, when in reality kids were were struggling because of the internet connections. And sometimes parents were, they went from paying like $15 for internet to almost $200 bill of internet because they wanted this in an effort to make school accessible for their kids. They were also struggling with paying food, housing bills, because a lot of farm workers did not qualify for the federal stimulus check because either they were from mixed status families or they were undocumented workers. There was also, in terms of health, they were worried about getting sick because they didn't want to end up. They were hearing about people dying because of COVID-19. They knew that this virus, could have a fatal result, and they were scared that they were to leave their families alone without any economic support. There was a lot of anxiety, and something that I came to find when I was interviewing them is that they didn't know where to look for resources in terms of for their health, their mental health, because they didn't have healthcare access. They didn't have insurance because most of them, once again, were undocumented and they didn't have that access available for them. They didn't know if testing was free. In some cases, they would show up to a testing site and then they would sometimes they would be asked to present either an ID or also a form or insurance in order for the test to be free. In Vista Community Clinic, I know that we did some testing for free, and then we tried as much as possible to spread the information about this testing sites being available. And one thing that we came to find out is that sometimes the time didn't work best for them. So what we had to do is we had to accommodate to testing sites that were to be maybe on the weekend, early in the weekend or mid in the weekend, so that they will be able to access this testing, because we came to find once again that they were having trouble accessing sites because they didn't know where to go and they didn't know if they were accessible and free. So definitely, I think that as a CBO organization, we had to step in response to this COVID pandemic, because the federal government wasn't really doing much. As you know, we have come to find throughout the years that every time a pandemic or every time an emergency occurs, the most affected are the farm workers who don't have a lot of resources allocated for them. Can we go to the next slide, please? And once again, yes. I'm sorry, Naomi.
Oh, yeah, I thought it was my turn, but go ahead.
Oh, okay. Thank you.
Well, thank you, Deysi. I know you were key in in-depth interviews, and those were very important findings of not really how emotionally stressful it was for people to not access testing and all that. And the findings that I'm going to share right now came primarily from the surveys, the first phase that we conducted. So this was when, everybody was struggling to see how they were going to adapt to all the different modifications that the social distancing was requiring them to do, including, the growers, the farmers. So what we heard from the farm workers that we interview is that 50% or more reported decrease of work. Why? Because either they were out of a job completely, or because due to the social distancing requirements, they were not working the same hours. They were smaller crews working in the fields, and therefore, their sometimes their work shifts went from 8 hours to 4 hours. One other thing that we heard is that, especially in the Central Valley, workers that used to be farm workers but were now already working in the restaurants or flea markets or other places that were shut down because of the pandemic, they had to go back to be farm workers. So that increased significantly the number of workers. And so one particular person that I interviewed said, well, my crew was normally 30 people. And so before the pandemic, during the pandemic, at the beginning of May, that doubled. So she said, in 4 hours, we're done, because, it's the double amount of people. So definitely that impacted the income of the families. And as we see here in the story of Pascual, a farm worker from the San Joaquin Valley, age 57. Well, in his case, it was the lack of proper immigration status, that he said, I was not eligible to receive the federal stimulus checks that were giving to citizen people. So that was another way in which their income was compromised. Next. In terms of the PPE, as I said before, definitely we hear that the workers who work directly with the farmers were more likely to receive PPE, but 50% of the work sites were actually providing this. But it was more than 40% that they didn't. And even when they gave them a mask, it was just one mask. And you know how hard it is to be in the field, the dust, everything. So having one mask was not enough. And people were left with the resources that they have to procure their own masks. And let me tell you that I visited small communities, for example, in Terravela, a little tiny community in Tulare County. The surgical masks were being sold in the little tienditas at $1 a piece. Sometimes you're putting the mask on and it's already ripping. So definitely that was a major problem, because at some point, even the availability of the mask, even if you were willing to pay for them, was not there. So it was not that you can go and find them easily in the store or a pharmacy. And despite that, there was a recommendation that according to CalOSHA, that the workers need to be provided a mask. That was not the case. And that continues to be the case with farm workers that we continue talking to. They are not provided a mask. And I just want to say that another thing that was also compounding the effects for farm workers, in the middle of the summer here in the Valley, we have extreme wildfires. So not only they had to receive the mask, they had to receive an N95 mask, and that was not the case. Next.
I'm happy to switch to slide, and Nayamin, just want to give you the opportunity to make a CalOSHA comment related to this quote from Eliseo, if you wanted to here, because I know you have things to say about CalOSHA.
It is very saddening, because I hope, it was not only the story of Eliseo, unfortunately, it was a story that is way more common. But Eliseo, another farm worker in the San Joaquin Valley, he reported that the bosses not only did not give them masks, they even laugh at them when they have the audacity of asking for a mask. When he asked for, well, what about soap and water so we can wash our hands? That's another thing that everybody needs to do all the time, but more so during a pandemic. But there were places where they couldn't even wash their hands, because the bosses, they were not providing them with those washing stations. And again, they laughed when they asked for those. So what Eliseo shared through interviews is that the coworkers called a CalOSHA, and they got together to present a report. And they were concerned. We don't want to be sick for this to be a case where many of us are being infected. And what happened when they called Kalosha is that they were told they're going to send letters to their bosses to tell them to do the thing, but they were not even willing to send an inspector. So that's how dismissive the response was, like, oh, that's not a big deal. This is not at the top of our priorities. So unfortunately, like Eliseo, I heard many stories like that. In one case, I personally filed a complaint because one farm worker was retaliated when she asked for the ability to social distance. She was scolded, and she was not allowed to work for one entire week, her and her husband. I submitted a report to Kalosha, and after I have provided them with the name of the contractor, with the sites that the contractor was going to be working at, weeks later, I received a letter from Kalosha saying, oh, you provided vague information. We cannot conduct an investigation. So when I was very upset, I called back the farm worker, and in tears she said, well, they don't care. We are not important to them. We're disposable. So that's just like so painful to hear, that someone feels that their health and their value is not even recognized.
Thank you, Nayamin. Are we passing back to Deysi at this moment? Okay, yeah, thank you.
Thank you. Yes, as you can see in the screen, more than half of COST participants responded that cost and lack of insurance definitely was a barrier that prevented them from accessing healthcare. And I was one of the associates that interviewed Rodolfo, age 46 here. And one of the things that he shared with me when I interviewed him, when I asked him specifically, what was one of his biggest fears? And he said, my biggest fear is contracting a severe case of COVID-19 because I'm undocumented, and I feel that if at some point I have to seek medical care, I'm afraid that they're gonna send me back, because if I hear that hospitals are at capacity or reaching capacity, and then if I show up to their doors, I feel that once they find out that I'm undocumented, maybe they're gonna prefer to give assistance to someone who is a U.S. citizen or a U.S. resident. Because once again, like Nayamin said, we are being told that we are essential workers, but what we're experiencing doesn't sound like we are being prioritized, or we're given the resources that we need. And it was really hard for me to this is once again, these are things that we know, right? I come from a farm worker family. At some point, I was also a farm worker growing up. When I was paying for I was sharing with the team the other day that I paid with my first year of college, my textbooks, I paid them working in the fields in Fresno, actually. And so it's been more than 10 years since then. And when it comes to, when we look at and see that we see that we haven't made any progress in terms of the resources available for farm workers, I feel that they continue to be underserved and to be left behind. And these are just testimonies, right, that continue to highlight these experiences, that there is this great need for resources allocated to them so that they can be safe, especially during a pandemic that is causing a lot of deaths in the nation and worldwide. Can we go to the next slide, please? Thank you. And once again, this is another interview that I did. I interviewed Martin also from San Diego. And one of the things that, once again, he's been in the U.S. for more than 20 years. He shared with me, and he was the only one working in his family because his wife had to stop working due to the fact that kids were now taking classes from home. And on top of that, they were struggling financially speaking, because not only was he the only one working, but at the same time, he also did not receive the federal stimulus check that the government, distributed in the beginning. I think it's going to be a year now since that happened, and he is undocumented. He didn't receive it, and when he found that the governor of California was passing, a state funding to support undocumented workers in California with a $500 check, he tried calling the organization in San Diego that was handling the distribution. Unfortunately, he couldn't get a hold of them, even though he left several voicemails. And then he kept calling day after day, and eventually he gave up, and he realized that, well, maybe they're not calling me back, but because there is such a huge demand for it and so little resources, that I'm sure that at this point we have already run out of that, and there is no way that I'm gonna get any help. And so once again, I think that one of the main things that really impacted me was when he said, I gotta keep working. I cannot stop working. I cannot harvest from a computer. My job requires me to be outside there, harvesting the fruits and vegetables, that we all need to survive. And I'm afraid that this is exposing me to the virus every day, and exposing also my family. But there's I don't have any other option. I gotta keep working because I gotta provide for my family. So yes, it's again another testimony of the need for better resources. Can we go to the next one? And as I mentioned earlier, my role in the Farm Worker Care Coalition is I work closely with promotoras, and promotoras are the trusted messengers of the community. Together we collaborate so that we can better serve the farm worker community. Sometimes we get calls maybe like once a week or once every 2 weeks, and the promotoras request us for things that they need, whether it is toiletries, whether it is PPE or food. And thankfully, we have received donations that make this possible. However, these donations are very limited, and we are really struggling to continue serving the community. And so I definitely feel that there is the need for robust funding for serving CBOs, so that we, through engaging farm workers, we can continue serving them, and we can continue providing resources that they need in response to the pandemic of COVID-19. And once again, I feel that we as a CBO had to step in response, but at the same time, the resources that we have at hand is very limited, and we only hope that we can receive more support so that we can continue doing this work. Can you go to the next one, please?
Sure. Yeah, I just wanted to chime in here quickly because it's 11:30 and just say COVID-19 continues to affect our team. Nayamin let us know that one of her employees at a CBO, the one that she runs, has an infection within the family, and so she's stepping in for that employee. And I just wanted to say, Nayamin, if you need to leave us, we understand.
Thank you, Lydia. Yeah. Sorry for the interruption. I saw a question that I thought I was able to respond related to air quality, that it's also a problem in the border region. I put my chat there, my response there, but my information is also available through the organizers of the conference. If there's anything else that I can do to provide information, feel free to reach out to me. And then again, I apologize, but COVID is still alive here in the Central Valley, and I had to go and cover an event. Thank you. Have a wonderful rest of your conference.
Thank you, Nayamin. Okay, I'll advance now to the next slide.
Thank you, Ildi. We had about, I would say, 15 interviews that were made in Indigenous languages, and this was only possible thanks to the support and labor of CBDIO. We were really honored to collaborate with them. They facilitated these interviews as a way to elevate the need for language accessibility and cultural competence. And as you can see in this slide, it says that only 3% of the COV's Indigenous speaking agricultural workers reported that they received PPE training compared to the 19.8% of non-Indigenous speakers. So this tells us that there isn't sufficient, that it isn't sufficient for safety messages and materials to be done in Spanish, as we know that there are so many other languages spoken within the farm worker community. And this community is also, or this population is also feels left out because there is very little material being developed in their languages. Lupe's concern here is that this is another barrier that Indigenous community faces when the material is printed and because they cannot read. So we found that even this is true for the Spanish speaker farm workers who, because a lot of the times the material is being developed in a language that is very academic, and sometimes there is terminology that is hard to understand and it's hard to process or to put into practice. So there is definitely this huge need for verifying degrees of literacy so that it's equitable and accessible and is diverse, so that they need to be put in place so that the farm worker community feels more supported and safer. And like I mentioned earlier, I felt honored that I participated, or the participants allowed me to interview them and they shared their stories with me. I feel that they are the backbone of the food system in the nation. The fruit and vegetables that they harvest support the immune systems of each and every one of us here every day, right? Especially during a pandemic that aims to weaken our defenses. It is important that we as a community also support the well-being of every farm workers, not because they are, their labor is essential, right? But because they are also human beings whose lives have not been prioritized or taken into account when emergencies occur. Can we go to the next one? Thank you. And once again, like I mentioned earlier, right? There hasn't been federal funding allocated to support the farm working community, specifically specifically because a lot of them are undocumented. So definitely we feel that there is a need to spend a sizable portion of the California budget surplus so that we can ensure that there is food and that the farm workers get the assistance that they need so that they can continue living a safe and healthy life. We also hope that we can continue developing hotlines that are specifically for farm workers community so that they can get the support in reporting violations, such as the one that Nayamin shared with us earlier today. There is a lot of critical information that is needed for our communities, and there's a lot of the support that they need. They need the agency to support their claims when these are claims that are, affecting their lives, and they need that support because, like Nayamin shared earlier, they don't want to be laughed at. They want that support, and I feel that as you all heard, I think it's definitely needed. There is also the need to pass the SB 562, that's Healthy California Act, that includes all Californians regardless of citizenship status. I think that one of the things that you all probably were aware is that the people the participants I interviewed, most of them were undocumented, and most of them said that they were afraid to seek healthcare because they don't have insurance. So definitely, this is a great need. And I'm quoting one of the participants that he said, "Nothing will make me happier than to know that my health is not in danger." And I think that applies to all of us. I think that the healthier we are, the more energy we have to continue, right, doing the projects that we do, the work that we do. And then we also want to anticipate future emergencies, to not forget the farm workers, to really, in order for a policy to be effective, their voices need to be included and they need to participate so that when something where if something were to pass, right, it's gonna accommodate to their needs, whether it is their language, whether it is the fact that their immigration status to accommodate to if they don't have to have a, for instance, a social security number in order to access the resources. And as I mentioned earlier, contract and fund locally based farm workers serving CBOs. Like I mentioned, we had to step in, right, to provide support for farm workers, but our funds are limited. And then there is that need for sustainable funding so that we can continue doing the work that we do, supporting the farm workers as best as possible. And that's only possible, right, if we have the necessary and sustainable funding. And also communicate consistently, culturally and linguistically appropriate public health and safety messaging. And this applies to what I was saying earlier when I said that there is indigenous population who feel left out because they haven't been receiving resources that they can understand or read. So there is definitely that need to also draft messages that is gonna be understandable by every population within the migrant or a farm worker community. Thank you.
Thank you so much, Deysi. And that's the end of our slides presentation here. You can see the contact info for all of us, Nayamin, myself, Deysi. There's our emails. I'll give you all a moment if you want to be taking those down. I think that you can probably find them in conference materials. Not sure about that, but you're connected to CAF. They know how to get to us. So I'll stop screen share in just a moment, and then we can have a dialogue, or the way that the webinar allows us to do a dialogue, right, is for you to put questions in the Q&A section, and we'll try and get to as many of those as we can. But we did leave a good chunk of time, the last 20 minutes here of the presentation, to answer your questions. So, and again, you can find out more about the study and find all of our reports and tools at www.covid19farmworkerstudy.org. And I believe that's in the chat as well now. So I'm going to stop the slide share. And then let's see, I'm happy to facilitate. I think that's me now, right? Facilitating questions and answers. I see one here that is, are you working with impact litigators / employment attorneys to create cases for lawsuits? It seems like the loss of money is the only way some employers are compelled to treat workers as humans and a valued asset to their business. Deysi, I'm curious if Vista Community Clinic or the Farm Worker Care Coalition is doing that specifically. I know that from the beginning, we have had members of the California Rural Legal Assistance, CRLA, and the CRLA Foundation in the mix of the project. And that, that is a powerhouse set of lawyers that work in service of rural communities and often farm workers across the state. And that that has been part of their charge and work. And I wish that Nayamin was here because I do know that in the Valley, Nayamin and CBDO and others have worked together with lawyers to continue to press the issue on Cal OSHA violations that are reported and never responded to. So the answer is yes, that work is happening. It takes resources, it takes time. And of course, as other people have commented in the Q&A, we're up against structures and systems that have long ignored and neglected farm worker issues. And so these are sort of hard won. When these cases do happen and they come together, they're hard won and they're sort of battleground cases. But Deysi, do you have any comment specifically from Farm Worker Care Coalition or Vista in your work?
Sort of like you also mentioned, Ildi, thankfully, we haven't had an instance where, from a farm worker asking to follow up on a claim. But we know that whenever they come to us for us seeking for a specific resource, we try to, like you said, connect them to the right resources so that there is a follow-up. And of course, they always have our support to continue pushing for that claim to go forward, and so that they feel supported and they feel like, we're here for them. Mm-hmm.
Yeah, thank you for that. We're happy to take more questions. I see the one that Nayamin referenced about air quality and answered, but Deysi, I wanted to give you a chance to answer that too, because the question specifically references the borderlands there. And it's about the air quality in the Imperial Valley, not your valley, but very nearby, around Calexico. Mexicali is horrible and worse since COVID. This is true across the borderland. What can you do to help? So do you want to talk about how air quality fits into the sort of health picture that we're talking about here, and what Vista does to address that?
Yes, actually, I do want to mention that the Farmworker Care Coalition. I'm new to the coalition, but I know that there has been efforts before, especially when the California wildfires happened. When actually there was a fire that happened not too long ago here in Fallbrook, which is closer to the Vista Community Clinic, and it's a little upsetting that a lot of times when things like this happen, the community organizations are the ones stepping in, right, to support, to fundraise, there is a lot of collaboration between different local community organizations doing the work. And actually, Vista Community Clinic, or for Farmworker Care Coalition under Vista Community Clinic, applied for a grant last year that would allocate funds to draft a emergency response plan that we once again distribute to families. And also in response to the pandemic, also we once again we received a donation that we were able to distribute to some families, some worker families in the area. And this included also families in the valley, families here in Fallbrook, so that they could have that monetary assistance too, for support. But yeah, once again, it's always our community organizations are collaborating to give that support.
Yeah, thank you. I saw another question from a woman named Martha Noble. Do local community health providers provide healthcare to farm workers? And do they understand that all people in a community will benefit from providing healthcare, especially vaccinations to protect everyone from COVID-19? Maybe I could say a few thoughts that come to mind, and then Deysi, this is squarely in your camp too, for sure. One thing is that, kind of the bottom line for me and the COVID-19 Farmworker Study is that COVID highlighted, exacerbated, really shone a really bright spotlight on very long-standing vulnerabilities within farm worker communities. None of the things that we described are surprising to folks that have been within farm worker communities or worked in coalition with them. They just revealed these very long-standing issues in terms of the way that our food system is structured, and the way that systems, whether it's the public health system, whether it's Cal-OSHA and enforcement systems, whether it's food distribution systems, just don't effectively provide support systems and safety net and care for the folks that are doing the labor of feeding all of us. It's just the reality, and has been for many, many, many decades, perhaps since the beginning of the invention of our food system in this place. So, I would say that what became clear very quickly in this pandemic is that is a problem that none of us we shouldn't ignore it for lots of reasons. And in COVID, where it was clear that we were only as strong as our weakest community member, right? Where we were all connected because of the virus and because of our desire to think about, community resiliency and preventing the spread. And suddenly we had people aware of vulnerability and concerned about vulnerability because they were worried about protecting their own communities from spread. It highlighted longstanding inequities and vulnerabilities, and then made it very clear that we're all interconnected here. I mean, we should know it. We should always know it. We eat food. People do the work to pick that and pack it and get it to us. We're like literally connected through the cells of our bodies, right? But like in terms of community health, it was very obvious that we were connected, and in a way that's sort of been the reason I think that this study has gotten the attention that it has, and that people have sort of tuned in again, both because of the stories highlighted some very horrific things about the way our system is structured that appealed to people, but also because it was very clear we're all in this together, and that there's some power in that, and thinking and sort of leaning into that, and like coming to understand that again. So around community health, I'll let Deysi speak to the specifics of of whether people are seeing it as an awareness, like, yes, community health benefits all of us. So I'll let her speak to that. On vaccinations, I just want to be clear that we finished our interviews in October, and vaccinations, if you can even remember back that far, like vaccinations were not there yet. They were a Trump promise, honestly, that we were all very skeptical about. And so we didn't interview specifically people on vaccinations, but our team clearly engaged to farm worker communities throughout is now very much in the vaccination, figuring out the puzzle of vaccinations and continuing to raise their voices, our voices, to make sure that essential workers are at the front of the line for getting vaccinations, and that farm workers can have access to them. So that was a lot of thoughts. But Deysi, I'll pass it over to you on this specific question. Like, do healthcare providers understand that all people will benefit from providing healthcare? Oh, you're on mute. There you go.
Okay. You would think that, it's been so long that I would have gotten the hang of it. But yes, so as a farm worker, as a healthcare center in Vista, yes, there is definitely that understanding, right, that we would all benefit from having access, but how do I say this? And maybe I can talk a little bit about the vaccination part, Ildi, because we, as you all know, farm workers, our agricultural workers can now start getting vaccinated. But once again, there is this problem where there is limited supplies. So yes, we do understand that there is the need, right, that to provide those resources, but our hands are kind of tied in the sense that we receive limited supplies. And now that you touched that subject, actually, we were told in the health center that I work for that we can now start vaccinating farm workers. We have been allocated a specific amount of vaccines. It's just a matter of the logistical part, right? Like we wanna make it accessible to them. If we have to go to them, we will definitely make it happen, because a lot of them are not close to the health centers. There's if they're in Fabro, they're far from the Vista city. So it's a matter of collaborating once again with local organizations, so that we can find the best way to provide those resources for them. Because yes, you're right, it will benefit all of us, community, and also them who, if we know, I think that one thing that I think that we're aware of is that a lot of farm workers also have chronic conditions. And so there is a lot of questions in regards to the vaccine, right? Can I be vaccinated? Would I be safe? Is this gonna, affect me more than it's gonna benefit me? So before even getting the vaccines to them, we also gotta share the information about the vaccines to them so that they feel confident to take it, so that they know that that this is a safe vaccine that is gonna benefit them, the community at large. But also we wanna let them know, right, that this is also a choice, right? And I think that I heard from someone the other day that at their work site, sometimes the bosses were saying, "Oh, you have to be vaccinated is the law," right? And so we also want to dissipate fears and misunderstandings and misleading information so that they have the accurate and safe information, and they know that it is going to benefit them. But we gotta make sure that we're delivering the right message to them.
Yeah, thank you, Deysi. One other quick comment on vaccines, and then maybe I'll move to the next question, is that our team had the chance to meet with the Secretary of Agriculture, Karen Ross, last week, and briefed her on the study results, and then had a good conversation about how to bring farm worker advocates and farm worker awareness and the sensitivity about developing programs that will actually function for farm workers to CDFA as an agency. And this week, we met with her and her staff last week, and then this week, they're now, at the governor's request, been charged with really ramping up supply of vaccines to farm worker communities. And thankfully, she has called our CBO partners that we met with and said, hey, we're hearing that this employer-based vaccine delivery system with pods of workers organized in this way could be a good way of getting vaccines to farm workers. What do you think? And I just want to point to that channel, open channel of communication, as exactly the kind of thing that we're hoping comes from this. Is there's a group of a diverse network of on the ground organizations for whom farm workers are not, quote unquote, hard to reach, as agencies often call them, but who are their families and their neighbors and their coworkers, and they're embedded in these communities, and we have to find a way to connect them really vitally with any attempts, vaccines or anything else, to serve farm workers. So maybe we're starting to see a little bit of that, and we'll hope that continues to just deepen, and that could be a change that comes from COVID that could be powerful. So I see another question from Hester Parker. Hi, Hester. What are your plans for follow-up studies, if you haven't answered that already? I don't think we have. We are in the formation stages, the idea, the kind of dream phase for the third phase of the study. We know there's more to tell, and the team of community-based partners and researchers, it has been thinking about ideas and tracking ideas since the fall about what that would look like. And one of the stories that feels like needs to be tracked and mapped and told through data is the way that state and local agencies responded to COVID-19 in farm worker communities. There's an array of executive orders from the governor, programs like the Undocumented Aid Fund, like Housing for the Harvest, like mask distribution through CDFA. And then local agencies and public health departments had their own kind of plans and support programs, some of which were much more effective than others. A lot of scrambles, a lot of missteps, a lot of things, a lot of money going in directions, some of it doing what it was supposed to, some of it not. And so we want to pull back and kind of tell that systems story. And as Deysi has very beautifully mentioned today, talk about the way that the systems tried to respond and then left gaps, and then CBO partners, community-based organizations, farm worker serving organizations stepped in to fill those gaps. And And we feel that that's the next story, and we can't let this pandemic pass, this emergency pass, without kind of tracking and mapping that and evaluating how we did and taking lessons forward, both of the things that worked and the things that we never want to do again. Deysi, do you have any thoughts on kind of the next phase? Or yeah, I can kick you the last question if you do.
Yes.
Yeah.
I think that you said it all, Ildi, and I think that yes, we're definitely brainstorming ideas on how to proceed with this, because we definitely want some action to come out of this. When I was initially recruiting participants, and I asked them if they wanted to be interviewed, they said, I would love to get interviewed because I feel that I want, federal government, the state government to hear my story. And I hope that they hear it and it prompts them to deliver, all this urgently needed resources that we need when it comes to healthcare accessibility, when it comes to building a safety net of, financial support relief for them, for us, right? For us and our families. And I think that maybe that's, I don't know, perhaps, is NetSpace is, a call to action. We're still brainstorming, and we hope that we can get all of your support so we can continue moving forward and attain sustainable and tangible resources for them, for our farm worker communities.
Yes, thank you, Deysi, for holding that up. That's so important. I mean, the whole goal here is to create change, and ideally long-term change, to address some of these very long-standing injustices. And so yes, it's clear that whatever the next phase of this sort of research is, that the next another piece of work on the table for our team is taking these stories and turning them into action, turning them into change. And thank you, Deysi, for saying that. It's this advocacy piece with the research together. And yeah, we invite anybody to join us in that work, and we'll need everybody. We have 2 minutes left. Maybe I can do just one last question and then say thank you. But Deysi, this is one for you. Have farm worker serving CBOs been able to successfully access private funding, like through COVID relief funds at community foundations? Do you know? Maybe that doesn't apply to Farm Worker Care Coalition. But,
yes, actually, the Farmworker Care Coalition applied for a grant a few months ago in response to the COVID-19 pandemic, and it received a private funding, which gave us flexibility in terms of how they were going to be distributed, because they were not requiring like a social security number from participants. And we were able to distribute about 300 checks of $500 each to families, farm worker families, undocumented families. And one of the things that we did we didn't specifically ask them, are you undocumented, right? We just asked, did you qualify for the federal stimulus check, right? And that was one of the requirements. If they didn't, they could apply for this fund, and it was a success. And we're hoping that we can continue, applying and hopefully getting this private funds, because it definitely helped us continue elevating these voices and supporting them, because there is that great, huge need. And I think that it was a bittersweet feeling for my experience, because it was me the one collecting these calls. Like, people would call, leave voicemails, and I would follow up with them, and then hearing their stories, right? Like, we only hope that we could help all of them, right? We were like, I hope that there was a way that I can help all of you, but at the same time, the funds are limited, and there are some things that we had to take into consideration. So people who didn't qualify in the first phase, we hope that we get funded again, and that we can continue helping others. But once again, it's been a couple months since then, and by now, I mean, $500, it's, you know, only good for certain things, and we think that those who were recipients of the first round, you know, are probably gonna also reapply. So we're just figuring those logistics. And once again, first of all, it's if we are gonna get funds again, right? So that's something that we're waiting to hear from.
Thank you, Deysi. And I think that's it. I think we're out of time. Thanks for the excellent questions and for listening to us today. And thanks to CAF and the Small Farm Conference for holding the space for us to have this conversation. Appreciate it. And hopefully our paths will cross again.